Hi, Professor Marshall. My name's Lauren Wright. I'm going to practice the wound care process. So removing old dressing, cleaning a wound, taking a culture, and putting on a new dressing. So first I'm going to do hand hygiene. And I will be introducing myself to the patient who has the wound already dressed. And then I will remove the wound after I put on some clean gloves. Okay, and I will start by pulling away from the patient's, this wound or the dressing from the patient's skin by pushing down on the skin instead of pulling on the tape. I will check the dressing, make sure that there's not a lot of discolored discharge, and then I will make sure that there's not a scent, and then I will discard this along with my gloves. And now I'm going to set up my sterile field. Only touching the outer 1 inch of the sterile field packaging. One of these I'm going to use as my culture, so just FYI on that. Here is a bandage. And then on this, I'm actually going to keep my gauze on the side so that when I wet it, it will still stay sterile on my field. Which side I want it to be on. It'll still stay sterile on my field, and then I don't have to, I can wet all the gauze instead of putting the gauze on here and whatever. What am I gonna do next? Okay. This is also sterile water that I put in here for my saline, sterile saline, and that will help me irrigate the wound. So now I'm gonna put on my sterile gloves. Okay, and I'm going to get started with irrigating the wound. I know that one of my hands will be dirty because I'm touching the patient and the wound, and the other hand will stay sterile, so I'm going to continue that process. I'll irrigate from the top to the bottom of the wound, making sure that it stays clean, and then I'll take a culture from my sterile field, take that culture, send that to the lab, and then after I will pack the wound with new gauze. So this is my sterile hand. I'm not sure if this was the right process, but we're just gonna go with it and we can talk about it.